Hip hop graft. We have no financial interest. So, what is this hip hop graft we are talking about? Well, to meet this rapper, we need to discuss about ONH pit. Optic nerve head pit is a part of spectrum of congenital cavitary anomalies, usually unilateral or sporadic. This abnormal structure creates an anomalous communication between the intra and extraocular spaces. ONH pit is sometimes complicated by maculopathy leading to progressive vision loss. Optic disc pit maculopathy is characterized by intra and subretinal fluid at macula. Though the source of this fluid is unclear, theories have suggested that it may be vitreous fluid, cerebrospinal fluid, leakage from blood vessels at the base of the pit, or leakage from choroid. We also had a classical case of a 35-year-old male who presented with defective vision for the last 6 months. Best corrected visual acuity was 618 and anterior segment was essentially normal. Posterior segment featured an oval-shaped depression in the intratemporal aspect of the optic disc and associated maculopathy. We see fluid mainly in the outer plexiform layers and mild fluid accumulation also in the inner layers. As patients suffer gradual deterioration of vision, a variety of interventions has been tried, but none of them has been established as treatment of choice. Laser treatment has been proposed, which creates a barrier to create a chorioretinal adhesion. Predominant approach for treatment in earlier days was pars plana vitrectomy only. Pars plana vitrectomy with additional procedures yielded better visual outcomes. There are reports of visual improvement using one or more additional procedures, and we in our patients use autologous scleral graft to seal the optic disc pit during surgery to prevent passage of fluid into the intra and subretinal spaces. And so this scleral graft is the hip hopper we are talking about, and in this video we will see why is it so. Under subtenon block, 3 ports are secured, but 225 gauge and 123 gauge was used, as the 23 gauge will help in easy transfer of scleral graft into the vitreous cavity. After core vitrectomy, tricot wash was done to stain residual vitreous, following which PVD induction was started. A gentle and complete PVD was attempted, as literature suggests vitreous traction to be responsible for optic disc maculopathy development, and spontaneous resolution has been reported following completion of PVD. A site over the sclera was identified. A small graft was harvested from superior aspect of sclera and placed over the optic disc pit. Fluid air exchange was done. And before injection of gas, the position of graft was confirmed. At this point, it was noted that the graft was displaced. So we used a forceps to place it in position, and then the light pipe was also used for the same. We can see residual fluid getting collected at the dependent position, which was aspirated through the cutter. Then again the forceps was used to tuck the graft in the pit and then the residual fluid was aspirated by the cutter. So basically our graft was hip hopping and dancing all over until the retina was completely dry. Finally, gas was injected. This is the fundus photo of first post-op visit with a sleidal graft perfectly in position. And finally, in conclusion, we would say that careful fluid-air exchange is the mantra for proper graft positioning. Thank you.